Now's the time to finally realize we the people must make some choices. If we want single-payer health care, now's the time to raise our voices.
Before us white folks were here, there were Native Americans that had villages all scattered around Puget Sound and up the various rivers. I live on Mercer Island, and apparently the Snoqualmie tribe had two tiny villages on the island that weren't much. And it may not have existed, in fact, when the white people hiked over and found Lake Washington, and there's this island out there. Anyway, it's just a reminder that we're immigrants, all of us, and welcome.
Okay, as I said before, thanks everybody for coming tonight, especially for folks in other time zones. We got several from the East Coast. I usually spend a few minutes reporting on what PNHP Washington has been up to the last month in our current healthcare reform activities with our local coalition partners. But tonight, in deference to the folks tuning in from the East Coast, I'll fill you in on that stuff in the meeting report, which I usually send out in 2 or 3 days. I can say the pace is picking up and we feel good about that. And a lot of that is due to Ronnie Shure and Healthcare as a Human Right Washington and Healthcare for All Washington, of which he's the president, and he's with us tonight. So we're going to start this meeting with historical footage of the expose of Willowbrook State School that was on Staten Island, New York in the late 60s and 70s. It was supposed to be a place where people with physical and intellectual disabilities would live and receive education and physical rehabilitation. As you will see and hear, it was anything but that. So we are privileged to have 3 people here tonight who played very important roles in its exposure and closure. Bernard Carabello joins us from New York City to describe how Trump's big bad bill slashes Medicaid will affect the disability community as well as millions of other low-income folks. Bernard, who has cerebral palsy, lived in Willowbrook from ages 3 to 21 and became a superstar advocate for the disabled after leaving Willowbrook. Willowbrook State School housed more than 5,000 people with physical and mental disabilities. Those of the residents were supposed to receive schooling and physical rehab. Most of the time, they did nothing other than lay around, as you will see in the video. After Willowbrook was exposed and shut down, Bernard was educated and has lived in his own apartment. He founded a statewide not-for-profit run by advocates with disabilities, for advocates with disabilities, and worked for 37 years for the state of New York, helping to improve the lives of people like him. He was awarded a Doctor of Humane Letters from the City University of New York in 2020 for his extensive work and service to the developmentally disabled in Staten Island and beyond, as well as his extensive advocacy for the rights of those with developmental disabilities, all of which align with the highest ideals of the College of Staten Island and the City University of New York. So we'll have a chance to take a look at that honorary degree. When Bernard retired and when he exhausts his limited savings, he will have to rely on Medicaid to help fund his health care and daily living needs. Now, with the current threat to Medicaid funds, unless we can turn this around, he and millions of others will likely suffer during the rest of the diminished time they have left. Bernard recently wrote an electrifying op-ed about Trump's big bad bill and its effect on disabled people, and you'll hear this in the video. Mike Wilkins and Bill Bronston, who are here tonight, were physicians who worked at Willowbrook and were fired for organizing residents' relatives to demand change there. They were part of a radical collective of healthcare workers living on Staten Island that supported lots of progressive and radical actions in New York City in the late 60s and early 70s. And I was lucky enough to be part of that group. We called ourselves the Frantz Fanon Health Collective, and some other members are here on Zoom tonight. If you're a part of that collective, raise your hand and say. Some people don't have their video on, but I see Kathleen, Brennan is here. She was part of our group. After viewing the video, we'll focus on what's happening now, that the Trump's big bad bill is going to make matters worse for people with disabilities and others. We have Allie Fitzgerald here, who is a disability rights advocate and activist in Washington State, and she will tell us about what's happening here and how we might be able to help out. We'll now jump to the Willowbrook video and afterwards focus on what's going on now in the Q&A and discussion period.
I visited the state institutions for the mentally retarded, and I think particularly at Willowbrook that we have a situation that borders on a snake pit, and that the children live in filth. I think all of us are at fault, and I think it's just it's long overdue that something be done about it.
Bernard is my best friend. He's my brother. He's my talisman. He's my I look to him and I see the possibility of humanity. I see optimism. In the days when we met, the other residents, they would have a life expectancy 25 years, 30 years. Bernard he went on to have a career in advocacy. He's become such a symbol of the possibilities, and also an indictment of all the lives and human potential wasted by that institutional approach to caring for the developmentally disabled.
I met you at Bill Bronx's house.
At his house?
Yeah.
On Staten Island?
That's where you did an interview.
How long have you been at Willowbrook?
18 years.
How long were you given physical therapy in school?
5 years. We started talking. And that's how we became good friends over 50 years.
Did I take you back into Willowbrook?
I never went back.
You never went back. Yeah. I wish that I never did.
It's been more than 6 years since Robert Kennedy walked out of one of the wards here at Willowbrook and told newsmen of the horror he'd seen inside.
I was working as a kind of a street lawyer representing activist groups like the Young Lords, and I met Dr. Wilkins and Dr. Bronston during a period of great disruption in East Harlem. They were volunteer doctors helping the kids. Mike called me at one point and said that he had just been fired from Willowbrook. And I said, "What's Willowbrook?" It sounded so nice, that lyrical name, the Willowbrook. I thought it was like a country club. He said he had just been fired and that the conditions there were so appalling that he thought it would be a great story for us to tell. And I listened. I had no experience at all with either institutions or with the developmentally disabled. So I was utterly unprepared for the reality of Willowbrook.
There was one attendant for perhaps 50 severely and profoundly retarded children. Lying on the floor, naked and smeared with their own feces, they were making a pitiful sound, the kind of mournful wail that it's impossible for me to forget. This is what it looked like. This is what it sounded like. But how can I tell you about the way it smelled? It smelled of filth, it smelled of disease, and it smelled of death. Who is it living on the ward that you live?
Disgrace.
Disgrace?
Yeah.
Why?
Every time they cut the aggressive more and more.
The attendants are trying their best, but the staff is just too small to do anything more than just try and keep the place clean. When there's only one person to take care of 30 or 40, nothing good can possibly happen. No rehabilitation, no training, nothing. The attendants are as much the victim of the conditions here as the patients are.
When I applied for my job, I was really never taken to any of the wards. They just accepted my application and they told me when I would start. And then I went to building 6, which was my building. And the building supervisor opened the door to the day room, and there was the chaos.
This was a secret enclave. The system had set up a way that would not allow any ordinary people to see what was going on inside these brick buildings. You have no idea what was inside, no idea the savagery, the squalor, the illness, the infectiousness, the violence. It was just the norm every day.
It had a stink to it that got into your clothes and into your skin. How unattended. It was hell on earth.
Why would you continue to allow people to share bathrooms with no doors on the stalls when you know 100% of them get hepatitis within 6 months of entering, and when the incidence of intestinal parasites and worms was incredibly high?
Well, they used to give out cookies and candy. They used to throw it on the floor, and they all get down and grab it. Man. And I never told nobody that it happened. It happened.
Had a stink to it that got into your clothes and into your skin. How unattended. It was hell on earth. It was really. I mean, I was an experienced person, but when I saw Willowbrook, it was something that seared my soul.
Well, Willowbrook has a long history, obviously, on this site. It actually was first chartered 75 years ago. And in the charter, it was described as a school for the education of what they then termed mental defectives. What we now would say probably would be people with intellectual or developmental disabilities. So it started out with this goal of educating and training people, and much of the coverage that you might see in the newspapers then was designed to encourage people to see this as a good option for their children. But very quickly, through underfunding and understaffing, it became really quite unlivable. At its height, it had about 3 times as many people living in its wards as the place was designed to accommodate.
I would get calls, for example, at the beginning that say to me, somebody's acting out. You need to sign straitjacket order. You need to sign a Thorazine shot to cool them down. And I didn't understand what was going on here at first. It took me a year to really see and figure out the evil, the relentless cruelty that was built into the system to maintain the status quo.
Lack of privacy, and that many of the people worked at that time because of the budget cuts. There weren't enough changes of clothing to go around, so there was nudity, chaos.
Nobody came into these buildings. Not the director of this place. Nobody came into those buildings. They were sealed off, as coffins. They were living coffins for devalued people.
Before Geraldo Rivera's expose, there was a young reporter, Jane Curtin, who went to Willowbrook and actually did a series of articles exposing the conditions. She was joined by Eric Arts, who was a photojournalist who took some powerful photographs of the horrific conditions there. So Jane really was the first to really bring public awareness to what was happening at Willowbrook.
I got to know then Mike Wilkins and Bill Bronston. They contacted me and told me that there was something that I should see, that they thought that I would be able to write about it. They had faith, I think, in my perspective on things. They walked me through the front door. I mean, I was with people who were taking chances, but there had been no prior exposure, so there were no alarm bells. So it was just three people going through the front door.
Nobody really believed it. When Jane Curtin did her articles in the Staten Island Advance, there were a couple of still photos, but still nobody believed it, and we were being denounced from pulpits and other politicians not believing us, and they were thinking we were just radicals bad-mouthing an institution that was doing its best.
The first thing I began to do was to bring the families inside to show them why their kids were being destroyed, why every time they come, their kid would be more and more damaged, more and more injured.
Bill Broster and I quickly observed and concluded that the most progressive element in that institution was the parents.
That led to meetings where I began to set up seminars for the families in order to understand why they have to get their kids out of here.
The parents got involved, they got organized, they got confident because their meetings were really big. We had a meeting of one Sunday with a large group of parents. The director, Dr. Jack Hammond, was invited. He was asked to take a public stand against the conditions where there weren't enough clothes, there wasn't enough staff. He refused. He said, I've been in this business for a long time and it won't work. They ejected him from the meeting at that point. That was a Sunday, and that following Monday, there was a memorandum circulated through the institution saying that no employee was allowed to attend a meeting of the parents' organization. But the next Sunday, I did attend, and so did Bill. And then we were promptly given our pink slips.
The supervisor in Building 6, a nice guy, but it was his job to hand me my pink slip and tell me I was fired, and I was pretty stunned. And his hand was shaking, and in his anxiety, he forgot to ask for the key. And I didn't remember that I had it. So I got home and there it was. And so, of course, it made me think, because one of my thoughts was, man, if people just knew, if they just knew about this place and could see it for themselves, nobody would put up with it. And so I slept on it. And the next day I called Geraldo, because I happen to know him from before.
Well, Mike called me at one point and said that he had just been fired from Willowbrook. I said, what's Willowbrook? It sounded so nice, lyrical name, but Willowbrook, I thought it was like a country club. He said he had just been fired and that the conditions there were so appalling that he thought it would be a great story for us to tell. And I listened. I had no experience at all with either institutions or with the developmentally disabled. So I was utterly unprepared for the reality of Willowbrook. I was horrified. I was appalled. It was beyond belief how horrible it was, how filthy it was. It was hell on earth. It was really. I mean, I was an experienced person. Very urban, very savvy. Did all kinds of drug abuse stories, and I was a tough guy. But when I saw Willowbrook, it was something that seared my soul. The administrators had a colder academic excusing in a way as thinking that we were naive, that there was something that we were missing. And I think that my ignorance was my strength, in the sense that I looked at it and said, are you kidding me? I mean, children unattended and smeared with their own feces and wailing under the sinks, their pants down around their ankles, eating slop. I mean, what is it that they don't understand?
What condition where every time you brought it more and more.
I got back to the eyewitness newsroom, and there were a barrage of calls from New York State officials angrily denouncing our trespassing and threatening lawsuits, and without authorization violated the privacy of the residents.
But there was no privacy anyway.
There was no privacy anyway. Very eloquently stated. They lived, everything all communal. So to his credit, Al Primo, the director of Eyewitness News, and the assignment editors said, okay, they suspended judgment. The film came back from the lab. They saw the film. Everyone's spine stiffened, and they said, we're going to go with this story. It changed the world.
But even Bernard, with his tragically eloquent plea for help, doesn't really understand that what Willowbrook needs isn't more money. More money would certainly help. At least the kids would have clothes and they'd be cleaner than they are now, but they'd still basically be human vegetables in a detention camp. What we need is a new approach. We have to change the way we care for our mentally retarded. We ask for change, we demand change.
The question was, what was the solution to this place? They wanted to fix it, of course. They wanted to pour another few millions of dollars into this place because they didn't have another alternative paradigm in their head. And our job was to stop them from fixing this place and to shut it down. We went into the federal court in order to try and get an emergency intervention. The lawyers brought in the top leaders in the United States to talk about what quality services for people with special needs look like. Their testimony was just amazing. It was the first time that the reality of habilitation services, individualized developmental services, was articulated in a court situation. And so as the trial went on, finally, the judge decided to get up off of his bench and come and take a look. And that closed the deal. Once he saw it, once he walked through it, no matter what they did to clean it up. And they tried to clean it up.
The expose really led to major changes in the disability system in this country, and various laws were passed which were designed to protect people with disabilities. In 1975 alone, 3 significant laws were enacted, leading up to the passage of the Civil Rights for Institutionalized Persons Act, which protects the rights of people with disabilities in institutional facilities, followed by the official closure of Willowbrook in 1987, paving the way for the Americans with Disabilities Act in 1990. So after Bernard left Willowbrook, he went on to become a civil rights activist for people with developmental disabilities, and really was a driving force behind the creation of the Statewide Self-Advocacy Association of New York State, or SANES as it's called. So he went on to do some great things after he left Willowbrook.
I had home to walk out when I left the institution. Yeah. I remember when I started taking the subway and the bus, I was scared. I mean, I had to get used to people looking at me walking and talking, and I remember when I first got on the subway, I got lost. I think about people like Dr. King and the movement back in the 70s and 80s. I thought in my mind, people with disability could be active in their own community and make changes, and that's how I got thought it.
You did pretty well.
Not make it about you, but make it about the other people that advocate for.
I think that's one of the great things that Bernard has done. He really has focused attention on the humanity of the disabled as something that was utterly ignored. And it was almost commodified in a sense. He has become a great man in his way. He was the first, at least in my knowledge, he was the first. He was the first one to escape and then become a public person and then bring attention to the horrors of the place where he was. And also by living independently and then having a career, he became an example of potential realized. So what are your proudest moments? So talk about getting your doctor's degree.
Yes. That is my most, and the funny thing about that, I got it and the other degree from the same place that I lived at for 18 years of my life. And that is very special to me.
Here we are. There he is. Where would he have been? Where would he have been if he never met Wilkins and Bronson? He get pneumonia because someone's shoving crap down his mouth, where so many of them died. Then have some abuse in the ward there. Where would he have been? It's instead he became a symbol of potential realized. We go back, it seems to me, we went back for the 10-year and the 25th year and the 50th, but I am very, very heartened by the fact that nightmare has become such a positive example of what's possible now.
For millions of Americans with disabilities like me, Medicaid means freedom. In 1972, I escaped the Willowbrook State School. There, I experienced torture and abuse alongside thousands of other people with disabilities. Though I'm best known for fighting my way out of there, I'm even more proud of the life I've lived since then. I have lived in my own apartment. I founded a statewide non-for-profit run by advocates with disabilities, and I worked for 37 years for the state of New York, helping to make the lives of people like me better. By the time I ended my career as a state employee, I was proud to have saved up for my retirement. For me, this was an important accomplishment. Unfortunately, I was never paid for my years of child labor at Willowbrook. 75 years old now, and my cerebral palsy has been getting worse as I've gotten older. Each day, I'm able to do a little bit less than the day before. It's a slow, scary process. Sometimes I think about how fortunate I was to get my freedom from Willowbrook, only to now watch it gradually slip away. About a year ago, I realized I had fallen into a trap all too familiar for people with disabilities. I had too little money for the supports I would likely need to keep me living in the community as I age. At the same time, I had too much to qualify for programs like Medicaid that can get me the in-home assistance I will need, and that other programs like Medicare don't cover. So I decided to spend down my hard-earned savings. Proud as I was of what I had earned, I knew that sooner or later I would have to throw it all away in order to survive. I've nearly reached my goal. I'm on the cusp of qualifying for Medicaid, but now Congress is threatening to snatch it away from me. Congress's current plan to gut Medicaid to help pay for billionaire tax cuts makes me feel like everything I've worked for, saved for, and now thrown away has been just to provide a big benefit check to the 1%ers. Worse still, what this means is that Congress is putting a price on my freedom and the freedom of millions of other older adults and persons with disabilities. Yes, over time, the kinds of in-home assistance I rely on to take care of my personal needs, for example, will cost something, though not so much that Jeff Bezos would miss it. But every day I wake up to read the news and brace myself for details about how politicians, most of whom know little about escaping an institution and now aging with disability. All I hear is politicians planning to make sure they don't pay too much to keep me in the community and out of the kind of institution I grew up in. Our politicians talk a lot about freedom, but whose freedom? I don't think the ones planning to slash Medicaid are talking about my freedom. For me, Medicaid is freedom. It's knowing where your next meal will come from. It's knowing if someone will come to help me to get out of bed and into my wheelchair. It's knowing that if I get to bathe today or not. Politicians who only talk about Medicaid as benefits or an entitlement program just don't get it. I know what it's like to lose my freedom. I lost mine when I was too young to know what it was. When I began the painful process of spending down my life savings, it was because I knew too well the price of my freedom. As it is, our country's policies make persons with disabilities impoverish themselves in order to get reliable access to a disability-related services they need to make it through the day. In other words, I knew my freedom would come at the cost of my dignity. Without Medicaid, the price of freedom for millions of older Americans and Americans with disabilities will only go up. It may mean going days or longer without food or help with dressing and bathing. It may mean relying more on neighbors, charities, and volunteer organizations to make ends meet. Finding ways to live in the community will get harder and harder. Community living for many will become community struggling, for others, community dying. What many people don't realize is that Congress's plan to cut Medicaid isn't just a problem for me and people like me with disabilities. It's a problem for everyone. Medicare funds hospital services that people without disabilities rely on. Medicaid funds services for older persons that Medicare doesn't cover. Medicaid funds services that millions of parents of students with disabilities need to keep them in school. Like it or not, we're all in this together. Decades ago, when persons with disabilities like myself finally started leaving institutions in large numbers, we encountered a lot of negative attitudes from our would-be neighbors. Even as reports about the abuses that happened to people like me in institutions came to light, people already living in the community fought hard to keep us from being parts of their communities. In other words, they were putting another kind of price on our freedom. They would rather pay lawyers to go to court rather than let us live next door. We called these not in my backyard attitudes, or NIMBYism for short. Nowadays, in all the reporting about Congress's plans for Medicaid and other services that millions of Americans with disabilities rely on, I see the same old unfeeling attitude about the price of our freedom coming up in new perverse ways. Some of these politicians will continue to back their big, beautiful billionaire benefits program. But for those who care, know that we Americans with disabilities have fought like hell to get our freedom. For those who don't, we'll all too happily show you how to apply for unemployment benefits after the next election.
Wow.
Now the Q&A.
That's amazing, Bill.
Yeah.
Freaking amazing.
So
Bernard is definitely a hero.
Yes, you are, Bernard.
So, Annie, can you?
You are.
Can you bring us up to data about what's happening in the Washington State in the way of organizing people with disabilities. And yeah, you've been a prime activist in that field.
Sure. So my name is Annie Fitzgerald, and if you don't mind, I'd like to introduce myself a little bit first, give you a little bit of background. So I was born with multiple disabilities and chronic conditions, and my life started out rough. Uh, I am totally gonna date myself here, but I'm a millennial baby, so I was an 80s baby, and even in the 80s, they were still talking about institutionalizing children with disabilities. Fortunately, my parents rejected that, and I learned from watching my mother advocate for me throughout my childhood how to be a disability activist for myself. And when I became an adult, I started really paying attention to what's going on in the disability community around me. And so about 6 years ago, I joined Democratic Socialists of America, and I immediately started working on their Medicare for All campaign. In 2021, I was one of the co-chairs on the DSA Medicare for All steering committee, and it was our job as a national committee to educate DSA chapters across the United States about how they could organize around Medicare for All. Unfortunately, that committee was disbanded at the end of 2021. So, but I continued to volunteer within DSA. Last year, I ran for state representative in Washington's 38th district. And we ran a pretty solid race. We made it all the way through to the general, got about 20% of the vote for a first time run on a shoestring budget. Because I wanted to be one of the first openly disabled representatives in the Washington State legislature. And that was around the time where I kind of connected again with Andre Stackhouse, the executive director of Whole Washington, and I started doing organizing with Whole Washington, and now this year I serve Whole Washington on the advisory board as director of disability justice and accessibility for Whole Washington. So now I've kind of given you a little bit of an introduction about, oh, I forgot one thing. Also in my DSA chapter in Snohomish County, Washington, I lead our healthcare and disability justice working group, and I also participate in the national disability working group that DSA has as well. So now that I've kind of introduced myself a little bit, I want to talk just a little bit about what I've been hearing from people in the community. First of all, we are frightened. We are scared. This big, as Bernard so brilliantly said in that video, the big ugly bill is going to destroy millions of lives, not just older folks with disabilities, as well as, people my age, adults under the age of 65, children with disabilities. It's going to cause a lot of damage. And unfortunately, there is the the local chapter working group that I currently lead, there's a chance that it will be disbanded. And right now, we are the only socialist, disabled-led disability justice working group in Snohomish County. And, you know, it would pain me deeply if that was lost, if that organizing was lost, because it creates a safe space for those of us with disabilities to come together, to meet, to find ways that we can organize in our community, find ways that we can advocate for each other. So one thing that, and I'm also very familiar with PNHP. When I was on the DSA Medicare for All Steering Committee, we worked with PNHP. So one thing that would be really helpful is to create some sort of like a committee or organizing group for folks with disabilities within Washington State, so that we have a safe space where we can organize, we can come together, we can help each other stay informed about what's going on, inform the community about what's going on, create a mutual aid support system. All of these things are going to be super important for making sure that when and if these cuts go through, that we are supported and that we know that the community cares about us. And so I think that's something that's, you know, going to be really important moving forward. I have spoken to multiple people with disabilities across the state and across the country, and I think that the biggest thing is, like I said, is building community. We don't know what the futures we're going to bring, but we do know that like the ACA subsidies are ending at the end of this year. We know that Medicare and Medicaid funding is going to be cut shortly after that. In Washington State, there are approximately, last time I checked, with like the US Census data, there are approximately 2 to 3 million Washingtonians with disabilities. 680,000 Washingtonians will lose health care through the ACA subsidy cuts, Medicare or Medicaid cuts. Also, I think that one of the things that wasn't even a part of the big ugly bill that scares me is the executive order to round up and institutionalize homeless people with mental disabilities. We do not want to go back to what people like Bernard went through. We cannot allow that to happen. We cannot allow that to happen to our most vulnerable populations. So I really think that these are areas that PNHP could be organizing around, and things that we should be really paying attention to, again, help people in these communities feel supported, feel loved, and feel cared for, because honestly, that goes a really long way. And I think that's all I have to really say right now. Thank you.
Thank you, Annie.
That was great.
Also, I'm happy to answer any questions if anyone has any questions about, organizing in Washington or anything like that.
I just want
Also, wait, one more thing. I just want to say something to Bernard real quick. Bernard, I've seen that film before. This was not my first time learning about Willowbrook. I've also watched the film Crip Camp, so I'm very familiar with the organizing that happened in the 70s and 80s. And I am so proud of the work that you did, because without people like you to crawl and literally crawling up the steps of the Capitol to like be heard and have your rights respected, I don't know if we would have the ADA, and I don't know if we would have the disability rights, the disability justice movement that we have today. So you honestly, like I'm fangirling out right now, totally fangirling, but I just want to say thank you so much. You are truly an inspiration, and honestly, like I sent you an email. I'm hoping we can connect after the call, and maybe you can give me some ideas. But thank you so much for being here and for the work that you did. Now I'm done.
Beautiful. Oh, thank you. Before we get into the discussion Q&A, I just want to put a couple of or share a slide up here that shows the effects of the big bad bill on a bunch of things, Medicare, Medicaid, and so on. So and basically, I won't go through it or read it, but when you get, when this goes up on YouTube, you can pause it and do a screenshot for yourself if we want to do that. So let me see if I can, let's see if this is it. Are you guys seeing this one?
Yeah.
Yeah.
Okay, so again, I'll just leave it here for a couple seconds, and then that's the first page, and then there's a second page down here that so when I put this on YouTube, you can pause it and take a screenshot. So I'll stop sharing now. And we're now in the discussion Q&A. So
I just say something?
oh yeah, Bernard, I forgot. You should comment on everything you've seen here tonight first. Yeah.
In the state of New York, everything we got homes and institutions are paid by Medicaid.
Mm-hmm.
100%. And they're gonna cut that. We're all gonna put all these people and staff, they get paid by Medicaid or something. That worries me a lot. And I'm talking about the institution and the are paid by Medicaid.
Mm-hmm.
I want to make sure that people have heard Bernard's profound insight into the role of Medicaid on 100% of the American population. 100% of all of you, as you age, are going to wind up in a nursing home because of the institutionalization that comes from the requirements of Medicaid expenditure to facilities, not families. And it's all an effort to completely strip wealth from every family and everybody in order to retain chronic poverty, impoverishment, as a fundamental identity and reality of the population that the billionaire class does not want to have play a role in the electoral system.
So in this Q&A and discussion, please raise your hand and I'll call on you. That's better than trying to put something in the chat. So open for raising people's hands. Everybody else should go on to mute, because anytime you make a sound, you interrupt the video. So anybody got anything to say?
Mike, you want to say something?
Yes. I get overwhelmed when I see the footage of Willowbrook. And we can't allow institutionalization to return. And it's not a guarantee that it is, that it's been obliterated. I think we're going to have to, humanity is going to have to fight against it. I asked a person that is still in the business of care for people with disabilities, if there's a state school anywhere in this country, and she said, well, I think they have one in Tennessee, for the quote mentally retarded, state school for the mentally retarded. We used to have them in every state, and now we don't. So there's a huge risk that this will come back, and people like Bernard that are. I think the self-advocacy movement is the strongest movement that will prevent it from coming back. And we've heard from the two people from the disability movement here tonight about their activity, and as we need to nurture that and support that in every way we can. Also, I love the mention of the Democratic Socialists of America. Thank you very much. That's very political. We have to get political on this. That's all.
David, how much time do we have?
We usually go till about 8:30. Sherry?
Yes, brings back memories when I finished medical school and internship. I did not immediately match into the pediatric residency that I ended up with. And I remember being offered a position at what I believe was a state school in the south suburbs somewhere. Does anybody remember? I don't remember the name of it. And there was Fircrest, but I think Fircrest shut down as a residential school, but it once was. Does anybody remember any of this or know what happened to those two places?
Are you talking about Southern New York?
No, I'm sorry. Washington State.
By the way, there's still 15,000 people in state institutions across the country. 15,000 are still in the old state institutions across the country that have not been emancipated yet.
Right. I'm thinking, Annie, do you have any knowledge about what we have in Washington State?
Yes, actually. Last I heard, Fircrest is still open. That was maybe a year or two ago. And related to this, so last year when I was running for office, I did a candidates forum with a local organization that supports developmentally disabled people. And after the forum, I was approached by a mom of a young teenage boy, and she is a member of PEPWA. It is a organization that is fighting so that parents of children with developmental disabilities can be paid for their labor, because currently in Washington State, if you are a parent of an adult child with a developmental disability, you can be paid for your labor as their caregiver, but you cannot for minor children. And I have been in communication with her ever since for almost a year now. And early on in this new administration, she had been talking to me about the trouble that she was having with the local school district, how they didn't want to educate her son because he was considered difficult. And the school district was actively encouraging her to institutionalize her teen son in a institution in Kansas. And they had just moved here from Kansas several years ago, thinking that Washington State, being a blue state, would be better about these kinds of issues. And in fact, we're not. And so the school district was literally trying to encourage her and her family to pick up and move back to Kansas, like relocate the entire family back to Kansas, so that her son could be in an institution and be cared for. This is the kind of thing that parents with disabled children, especially parents who have disabled children that require 24-hour-a-day care, are facing in our state. And they need advocacy, they need support as well.
David?
Am I frozen?
David.
Yeah, okay. Bill, I saw you wanted to say something, so you know how to raise your hand, right? So next time, raise your hand. So go ahead.
I just wanted to make sure that people got a chance to talk, that we're on the call. So let me tell you that this discussion, my role here probably is closer to Bernard's, and that is that my book, Public Hostage, Public Ransom, Ending Institutional America, is an atomic narrative documentary with 80 photographs in it, 380 pages, that you can get online with an audio reading, or you can get a copy of the book from Barnes & Noble, from Amazon, from eBay. And it essentially lays out the interior struggle to shut down Willowbrook and to go on to deal with the economics and the politics of what it's going to take in order to end Medicaid. Medicaid is altogether evil. What it does, it forces people into lifetime poverty. There's nothing good about Medicaid other than if it wasn't there, there would be a tremendous amount of suffering and death, but it is fundamentally wrong. And my website, which is called ourhealth.pub.public, lays out a piece of work that I did with 40 key leaders from around the country every Saturday for 2 hours for a year to imagine the most ideal population-based single-payer healthcare system in the world in writing. And I urge people to look at it, study it, and then at some point would love to come back into a conversation like this in order to have some meaningful exchange about the policy implications that are built in there. For example, Medicaid essentially finances long-term care, which means institutionalization. We're proposing that people, once they get to be about 50, become part of a thing called lifetime care, which would be individualized planning to ensure deinstitutionalization as people got older and to maintain themselves in multi-generational community-based, intimate circumstances that don't require them to be in situations where the workers are one half a step above them, and essentially they are essentially made vulnerable for epidemics like COVID and so forth because of the impoverishment of these nursing homes, the crowding of these nursing homes, and the cultural antisocial framework that people experience once they're put into a lockup, once they're put into a congregate segregated facility. We must not make more institutions, and Medicaid is the fundamental priority financing system of that work. Willowbrook would not have existed without Medicaid, and the profits that come from funding these institutions are phenomenal. So much so, 70% of the programs that are funded by Medicaid are now in the hands of private equity organizations, stock organizations, no longer population-based, free, tax-grounded, single-payer systems.
So in the video, there's a shot of Bill's book and a QR code to where you can buy it. So when you get the video on YouTube, you can pause it and take a screenshot there. And so that's where you can find Bill's book.
It's a killer.
Okay, Annie?
I just wanted to say something about Medicaid. So I have plenty of experience with going on and off of Medicaid throughout my life. And like in Washington State, you have to be extremely poor. You have to be extremely impoverished. We're talking like I don't qualify for Medicaid, and my sole source of income right now is my SSDI benefits of $14.35 a month. I make about $500 or so too much to qualify for Medicaid. And
Brutal.
and when I as I was getting older, about a year ago, my condition, my physical disabilities started to get worse. And so I started to need help with some things. You know, I'm still relatively independent. I still am. I'm very stubborn about being independent. But I need help sometimes with, you know, cleaning the house or running to the grocery store, or, you know, may need help sometimes with personal care. And I was considered to be too high functioning because I had showered in myself in the last 7 days. It's things like this that get in the way of people getting services that they need. And what I learned after I got denied and told that I would have to be a part of, or in order to get Medicaid, that I would have to participate in the Medicaid spend down program. I was like, well, I don't have any money, like, you know. And so I found out after I had applied and been denied that they are actually using AI. So like you talk to a caseworker, a case manager, who does your intake, takes all of your information, and then they take that information, input it into a computer, and AI, not a human being, AI decides whether you get Medicaid services or not.
Incredible.
And so, you know, and if AI decides, if the computer decides that you are too high functioning, or that, you know, your SSDI payment's too high, which, I mean, in my area, it's not enough to live on in the first place. Like, you're out of luck. So like the whole system needs to be revamped, and because it's not working, and it's letting people like me, it's letting people like Bernard down. It's failing all of us.
Hugh, talk about Cuba.
So, Bernard, are you getting Medicaid now? Or?
No,
No, I didn't think so.
I get Medicare.
Medicare. But you could get Medicaid also if you
No,
get rid of whatever savings you have left, right?
yeah, I have to put my money into a pool, and they pay all the bills, and whatever is left over, they give it to charity. My money is up from the charity. That doesn't make sense at all.
Right. Okay, somebody, if you're not talking, please, mute yourself because it interferes with the video. So anybody wants to discuss or ask a question, raise your hand.
Hugh, talk about Cuba.
Well, yeah, that's where we met. Bill was, when was it, 2013, when we went as a contingent of people. It was, the thing that's amazing there is how they have survived, and it's a totally different focus of their entire society, right? They believe in human capital rather than financial capital in order to organize themselves and as a fundamental focus of their society. One of the most remarkable places we visited when we were there was an institution for children with disabilities. And the people there, of course, it was clean, it was well staffed, etc. But the other thing that really impressed me was their community organizational structure, where what we would call maybe a state legislative district of 3,300 people, they had a political organization that was really the community center, clubhouse. They had that organized themselves also for places in the community to care for the elderly, the grandfather and grandmother's houses. So it was a totally different focus in terms of the organization of their society, their fundamental motivation, and also the organization of their medical care, which was abysmal and non-existent before the revolution, right? Remember, they told us that there was one medical school in the whole country. And after the revolution, they had a medical school in each of the 29 provinces of the country. So it's a totally different focus. And I think we were in trouble before the current administration. And now they've just taken it to an unbelievable level of uncaring, dispassionate focus on taking care of the very wealthy, and the rest can just be cast aside. So that was I think that was one of the most life-changing 10 days I've ever had in my life. And when we came back and Quentin Young came and visited us in Seattle, he twisted David and my arm with the help of one of our other colleagues, Erica Goldstein, to start our state chapter of PNHP. And now we're 18th year, David? And I just wanted to give a shout out to David McClanahan, who is the heart and the soul and the draft horse team of our state chapter. I mean, just putting this together, David, you've done a remarkable job. Thank you very much.
Well, thank you. And Hugh is also on the national board of PNHP. Used to be, but I'm a board advisor now. So we've got some twist at the national level. Yeah, that was an amazing trip, and Bill organized the health delegation. What was there, about 18 or 20 of us that went and visited the Cuban system from top to bottom, including the Latin American School of Medicine, which is a free medical school for underdeveloped countries all over the world, and actually from underdeveloped areas in the United States. There's something like 200 US students have gotten a free medical education, and with the proviso that they come back to where they came from and work in their communities. So every time you see something about how Cuba is being blockaded and this and that, it's really reflective on where we are as a society.
They export more doctors than they export cigars. All over the world, all over the world. The 22nd Medical School that David's talking about has 20,000 students in it, not one of whom is a Cuban, and all are provided a comprehensive medical education for 6 or 7 years. They learn Spanish, and then they work in the community throughout the country. And there's a doctor at every level of government in the country of Cuba in order to participate in whatever policy that level of government addresses, whether it's 10 square blocks or provincial or nationwide. The doctor is the vice president of the People's Assembly at every political level of the organization.
And also, if there's a medical emergency anywhere in the world, almost, they have crews of doctors that can fly out immediately to help out in that situation. And it's interesting and reflective on our country that when we had the hurricane hit New Orleans, they're only like 100 miles away, and they said that they would supply a brigade to come in and help take care of all the injured people there that we weren't able to keep up with. But our government said, no, we don't want you to come.
Same thing in Florida.
Yeah.
Anyway, our health is based heavily on that model with an American kind of twist to it. You'll see when you get a chance to look at it. It's really, really dramatic, and there's huge, huge policy issues. For example, we need to buy out all medical debt at the front end. We need to buy out all tuition costs for all health trainees at the post-secondary level, medical, nursing, psychology, social worker, med tech. All that tuition has to be removed so that we build a better workforce, a more complex and altered workforce in America, and get away from the white doctor domination and corporate ownership of the medical market system, because we do not have a healthcare system in America. It's a medical market system.
So does anybody else want to participate in the discussion, ask a question? We've been kind of some people hogging it. Now is your chance. Hugh, unmute yourself.
You know, I just want to make a shout out to I've put together a talk about the situation, dare say, system of healthcare delivery in this country. And I want to give a shout out to the osteopathic community in this country. I mean, many of you are aware, you cannot try to get a doctor's appointment in this country. I mean, it's a minimum of 3 weeks. For a specialist, it's 3 months or more. 25% of the physicians in the United States of America were not born here and not trained here. They come from, we suck 8,000 to 10,000 physicians out of the rest of the world, and most of them the poorest countries in the world, every single year into our training programs. And we have not kept up with the demands of our growing population and medical needs for a long time. We've relied on that siphoning of this precious resource from the poorest countries, and it's a matter of restriction of trade. In response to that, the osteopathic physicians in this country have thumbed their nose at the Flexner report, which demanded that a medical school be associated with a university, a research university, and have started medical schools around this country. The most active members that are not retirees in our state chapter are students from our osteopathic medical school in Yakima. There will soon be 3 osteopathic medical schools in the state of Montana. So the osteopathic community in this country has risen to the challenge and are starting to train physicians outside the confines of the Flexner report to help address the need for our country. So we're very fortunate we've got Gleb and Munif and Simi and all the rest of you from the school in Yakima. And I just want to give a big shout out to you and your colleagues for stepping up to the plate.
I forgot the time in Willowbrook before Mike and Bill came. We had no number of doctors from other countries. And we could understand a word they said at all.
Yeah, I can editorialize about that. They weren't a good example of doctors from other countries, I must say. I'm sorry, but they took a job at Willowbrook because that was the only place that would hire them, and some of them were great, but some of them were very poorly trained and also had very bad attitudes toward disabled people.
Oh, yeah. Oh, yeah. I remember when I had appendicitis, the doctor was acting out on me, and I could keep still. He said, well, if you don't keep still, I can put this needle in your nose.
Yeah.
That's the kind of doctor we have.
Yeah. Well, we've covered a lot of material, but I have a lot of feelings about the osteopathic community. I was the first MD in Kansas City, where I'm from, to have a osteopathic partner. And he was just equally good as a physician as I was, that's for sure. And they also provide services in rural communities across Missouri. I can speak for Missouri. And some of the best doctors I've known have been osteopaths. Also, the percentage of women in medicine has grown a lot. And I think that's been a huge sea change within our the ethics and the vibe of our community of providers since I graduated medical school in 1967. So I've seen a lot of change, as have some of the other people here. And it's a lot of it's pretty much for the good, but it's still, as Bill has said, it's based on money and your ability to pay. And it's not equal at all for people. I see it in the community that I live in. People don't go to the hospital or even to the emergency room, many of them, because they don't have insurance. They'll break you in a heartbeat, financially. There's huge problems.
I guess I should raise my hand here, right? The average indebtedness of a medical school graduate in this country now from an allopathic school is about $250,000. So they come out of with their MD degree in one hand and an indebtedness of $250,000 in the other hand.
Yeah.
And then, unfortunately, a lot of the osteopathic schools are even more expensive. But that's just an average. That's state-funded and private schools. So they are, in essence, an indentured servitude to this system, this financial system, right? And they're forced to participate in it because they don't have any financial choice.
Please read my book. Please read my book. And then I would love to have a session where we talked about the implications of it.
Okay, Annie? Look,
I just wanted to say that like since we had COVID, I have noticed that, you know, a lot of doctors, a lot of medical professionals have left, have retired. Even in the last like year and a half, in my own personal experience, like I have conditions that I'm supposed to be seen for and monitored for monthly. In the last year and a half, like last year, I saw my primary care doctor all of about 4 times. And the problem is that we are losing a lot of doctors. We are losing a lot of nurses. We've lost a lot of healthcare staff. So now it's not unusual if I have to wait like 2-3 months to see my primary care doctor. And then specialist appointments. I'm lucky if I can get into a specialist, which I have multiple, within like 3 to 6 months. And unfortunately, what happens is if you have an emergency or a medical problem between those appointments, the doctor's office, they'll often tell you to go to the emergency room. Well, I'm not going to go to the emergency room unless I am dying, because I know that I know that 2-3 months later, I'm going to get a massive bill because I know that my Medicare Advantage plan is not going to cover everything.
If you get
So,
seen.
yeah.
If you get seen.
If I get seen, and half the time when you do go to the ER, they do all those expensive tests, and then they tell you, oh, well, go home, see your doctor. Like, so it's getting worse as time goes on, and you know that's another way, and it's only going to get worse with these cuts because hospitals, on average, 60% of their funding comes from Medicaid patients. So what happens when they lose all that funding? Well, everyone is going to suffer.
Okay, so we've come to our usual end of meeting. If there's anybody else who hasn't had anything to say, want to say something? If so, unmute yourself and you can just start talking. Okay, Vic?
Yeah, the question is for William Bronson. William, you mentioned about private equity. I have a question. I heard that a lot of, even in the hospital, even if you're insured, the parts of the hospital, specifically the emergency offices, they're run by private equity.
Right.
So, right. So, can you explain that a little bit? Is that really true? And how pervasive is that?
70%. 70% of the medical budget out there for the system is owned by private equity, which includes the 70% of public dollars that they absorb as their profit-driven, kind of handle on the system. It's just really, it's astounding. We have a commodity-based system, and there's a beautiful book written by a woman named Bolton, Bolton, called Health Communism, which is really powerful. It's a tiny little blue book produced by York Press in London. And it's also something that I would urge you to look at. It's really powerful. that explains a lot of this stuff. All this stuff is driven by money. It's all driven by money. And right now, we're talking something in the vicinity of about $7.6 trillion, which means we're talking about roughly $17,000 to $18,000 per man, woman, and child in the United States for what they're getting their medical market services from. I mean, it's astounding, astounding. And we've got to end it. We need a health revolution. You know, it's not a gun revolution, but this is, we need to focus on this. It's really, really will change America if we're able to succeed.
Okay,
100%. Thank you.
Ronnie?
Yeah, and I just wanted to call out our advocacy friends from Whole Washington who have joined us tonight. So, and thank you, Annie, for stepping up, and for Catherine and Pam for all of the work that Whole Washington has been doing to help change our healthcare marketplace into a true healthcare system. So thanks for joining us tonight.
And thanks to you, Ronnie, for recommending we get in touch with Annie, because this is an incredible addition. All right.
Bernard, do you have a book?
No.
It's time. What did David read from? What was that long quote that he read?
I wrote that.
No, I got that, but you know, you need to publish. You need to publish something and get it out there.
Yeah, that's an amazing piece too.
Yes.
Yeah. So I will edit this video. Usually it takes me a day or two, and then it goes on YouTube, and then I blast out a meeting report, and in that meeting report I'll talk a little bit about other things going on here. So this has been a wonderful meeting, and thanks to everybody who's participated. Even I see several from the East Coast. Wake up, Kathleen.
Thank you.
Kathleen was one of our Friends for Non-Health Collective in Staten Island, along with Mike and Bill, who were here tonight.
Thank you, everybody, for attending. And we'll be doing something again, probably the third Wednesday in September. So please stay in touch. Remember, you can look at our website, which we're working on to make even better soon, we hope. So it's a bit of a struggle now, but keep in touch on our website, PNHPWashington.org. And stay healthy, stay independent as long as you can, and then accept help when you need it. My husband and I just moved into a senior living facility on Mercer Island. So we are in a place where we are guaranteed care all the way down. But it doesn't take Medicaid. We have to be able to pay for it, which we can. We're fortunate. So we need something like that works for everybody. I would be interested in how that works in Europe, where most of the countries have single healthcare systems.
They have socialist parties.
Well, they aren't all socialist parties, but they still have single payer healthcare. And so I would be interested in how they handle it. But topic for another evening.
Right.
Okay.
You can send us suggestions for what you would like to see in one of our monthly meetings.
Sure. We would appreciate that.
Anyway, I'm going to count down from 5 to 0, and on 0, I will click end meeting. And thanks for all you folks showing up. And I think it was a great meeting with good participation. So, bye.
Thank you, everyone.
Thank you. Bye.
Thank you, David.
Three.
Bye.
Thank
Have a good day.
you.
Bye.
Have a great night.